Hello, my name is Dr. Rajiv. Welcome to my education channel, YouTube Surgery and Orthopedic Education. Today we shall talk about blood types, antigens, antibodies and Rh factors. Have you got your notebook ready? Okay, please subscribe to our channel and give us a like at the end if you find the lesson useful. So let us not waste time anymore and get going right now. Human RBCs, platelets and neutrophils have on their cell surface many different allogenic determinants or antigens. These antigens or determinants form blood group system. About 380 different blood group antigens have been identified and classified into 44 different blood group systems till 2022. The ABO blood group antigens are the most immunogenic of all the blood group antigens. Antibodies comprise anti-red cell antibodies, anti-HLA antibodies, anti-platelet antigen antibodies or HPA antibodies and anti-neutrophil antigen antibodies or HNA antibodies. Anti-RBC antibodies may result in hemolysis, while anti-HLA or anti-HPA antibodies may result in other transfusion reactions such as fever and platelet transfusion ineffectiveness. Furthermore, anti-HLA and anti-HNA reactions may result in a serious lung disorder called transfusion-related acute lung injury. The antibodies against RBC antigens may be of either IgM or IgG class. Some IgG antibodies cross the placenta and cause hemolytic disease in the fetus and newborn. Two antigen systems that are most important in surgical practice are the ABO and Rhesus systems. ABO blood groups. Human red cell membrane contains a variety of blood group antigens, which are also called agglutinogens. The most important of these are the A and B antigens. These antigens are genetically transmitted as Mendelian dominants. The ABO gene is located on chromosome 9. Antibodies against red cell agglutinogens are called agglutinins. Infants naturally develop antibodies in their plasma against the antigens not present on their own red cells. These antibodies are found in the plasma for the whole life of those lacking the corresponding antigen. The A and B antigens are complex oligosaccharides that differ in their terminal sugar. The ABO system has three main allelic genes A, B, and O. These control synthesis of enzymes that add sugars to RBC cell surface glycoproteins. The A antigen has N-acetyl galactosamine and the B antigen has D-galactose as the dominant sugar. The O allele encodes an enzyme with no function and therefore neither A nor B antigen is produced. There are four main blood group types A, B, AB, and O. Blood group A has A antigens on red cells and anti-B antibodies in the plasma. Blood group B has B antigens on the red cells and anti-A antibodies in the plasma. Blood group O has no antigens on red cells but has both anti-A and anti-B antibodies in the plasma. And blood group AB has both A and B antigens on red cells but no antibodies in the plasma. Blood group O is the most common blood group and AB is the least common blood group. The ABO system has only 4 phenotypes and 6 genotypes. Blood group O is the universal donor group as it contains no antigens to provoke an antigen-antibody reaction. Group AB persons are universal recipients and can receive any ABO blood type because they have no plasma antibodies. The blood group of the offspring is determined by the dominant genes inherited from the parents. Each blood type can be either RHD positive or RHD negative. Thus, in total, there are 8 blood groups. Many associations have been seen between particular ABO phenotypes and an increased susceptibility to disease. For example, The O blood group has been linked with stomach ulcers and the A with stomach cancer. Individuals with blood group O tend to have lower levels of von Willebrand Rh or Rhesus system. Red blood cells sometimes have another antigen known as the Rhd antigen. If this is present, blood group is called Rh positive. If it's absent, the blood group is Rh negative. The Rh system comprises nearly 56 antigens. The most immunogenic one is the Rhd antigen. The Rh antigens show partial expression due to high diversity. The Rh system has two genes located on chromosome 1. The Rhd antigen is strongly immunogenic and is present in approximately 85% of the population. Antibodies to the Rhd antigen are not naturally present in the serum of the remaining 15% of the persons, and so they are called Rh negative. But their formation may be induced by the transfusion of Rh positive red cells acquired during delivery of an Rhd positive baby. The Rhd system has the main importance in obstetrics because it is the main cause of hemolytic disease in the newborn. Acquired IgG antibodies during pregnancy may cross the placenta and, if present in an Rhd negative mother from a previous delivery of an Rh positive baby, may cause severe hemolytic anemia and even death, known as hydros fetalis, in an Rhd positive fetus in utero. In most cases, ORHD negative blood or O negative blood can safely be given to anyone. It's often used in medical emergencies when the blood type is not immediately known. The O negative blood is safe for most recipients because it does not have any A, B, or RSD antigens on the surface of the donor red cells, and therefore the O negative blood is compatible with every other ABO and RHD blood group. Out of the 44 blood group systems described, 5 are routinely tested. These are Rh, KL, Duffy, KID, and MNS. Testing for all these 5 group types ensures a blood transfusion compatibility of 95%. KL system. The KL system has 36 antigens. The KL1 is routinely determined. 9% and 2% of individuals of Caucasian and African origin are K positive respectively. The immunogenic potential of KL is third after the ABO and Rh systems. The expression of KL protein is X-linked. The rare absence of KL protein is associated with acanthocytosis, shortened RBC survival, and McLeod phenotype. Duffy system. Duffy system comprises 5 antigens, 2 of which are routinely tested. 3 common phenotypes are expected: FYA plus B plus, FYA plus B minus, and FYA minus B plus. The Duffy antigens serve as receptors for Plasmodium vivax. KID system. KID system comprises 3 antigens, 2 of which are routinely tested, the JK1 and the JK2. MNS system. The MNS system comprises 49 antigens, 4 of which are routinely tested. Hh blood group and Bombay phenotype. The Hh blood group contains only one antigen, the H antigen. The H locus is located on chromosome 19. The H antigen is found on all RBCs and is the precursor for the production of the ABO blood group antigens. The absence of H antigen is known as the Bombay phenotype. It is found in 1 out of 10,000 individuals in India. The H deficiency causes no ill effects, but if a blood transfusion is ever needed, people with the Bombay phenotype or H negative blood group can receive blood only from donors who are also H negative. Because the H antigen is the precursor of ABO blood group antigens, if it is not produced, the ABO blood group antigens are also not produced.